The podiatry service is specifically for the residents of Eastern and Coastal Kent, and our team specialises in all aspects of foot health. Podiatry services are offered at 39 locations across the community. As well as that, we have a day surgery unit at Queen Victoria Memorial Hospital in Herne Bay. At the initial appointment, a full assessment is made of the patient's foot care needs and a diagnosis is made. An individual treatment plan is discussed. The patient may be shown some exercises, advised on changing their footwear, or shown how to care for their feet. We can see people suffering from nail problems, corns, callus, verrucae, foot and toe deformities, as well as those suffering from the complications of diabetes, poor circulation and nerve damage.
This gentleman presents with neuroischemic foot with the foot ulcers. We're seeing him here in the community clinic, and we also see him in the diabetic high-risk foot clinics we have within the hospitals.
Well, it was about this time last year with the actual ulcer started to get really badly infected, and the podiatry team that have been looking after me, they were fairly confident that they could actually rescue my leg, which I was quite pleased about in the end. So it was I'm very, very grateful for what they've done for me.
As you can see on this x-ray, there's a small...
All our podiatrists have undertaken 3 years degree-level training and are registered with the Health Professions Council. In addition to that, our podiatric surgeons have undertaken at least 5 years extra training in order to be able to specialise in foot surgery.
Okay, Lola, what we're going to do now is we're going to have a look at you walking with your shoes on and your orthotic in.
Lola has Beckwith-Wiedemann syndrome, which was picked up at birth, and it basically means that her left side of her body is bigger than the right side of her body. So she's got at the moment, a 6 centimetre leg length discrepancy. It was about 3 centimetres at birth. So obviously walking is a bit of a problem, so she has to have a raised up shoe and also an orthotic in the shoe to help control the movement of the longer leg. I think I've been most impressed by their willingness to try different treatments for her. It's an unusual condition, and they've tried different treatment options until they've actually got it right for her, and she's more comfortable now.
I feel very lucky to work within this podiatry department because we've got a wide breadth of specialisms within our department, and I always feel that there's somebody that I can go to if I would like a second opinion. We also have a great facility here in Herne Bay where we can watch people's gait and do a full assessment of their biomechanics.
The podiatry department has a purpose-built laboratory at Queen Victoria Memorial Hospital in Herne Bay that makes in-shoe orthotic devices. Podiatrists prescribe these for patients to correct the way their foot functions. The patient has a plaster of Paris cast taken of their foot in their local clinic. This is then sent to the laboratory where the technicians use the latest computer-assisted design and technology to manufacture the device for each individual patient.
I've had the problem over a year. During that year, twice it's flared up. I've had to go to the doctors and they gave me antibiotics to cure the pain and get rid of the inflammation that was on it.
The podiatry team in East Kent is wonderfully supportive. It's a very nice place to work. We're very fortunate in that we have the whole range of treatments that we can give to patients with foot problems.
We have podiatrists specialising in diabetes, rheumatology and arthritis, treating and correcting foot function, as well as those who specialise in nail surgery, sports injuries, children's foot problems and foot health education.
It's extremely painful, and if I do any amount of walking or standing, it's quite an excruciating pain underneath and on the top, and I ended up standing like a penguin on one leg and taking my foot, out of a shoe or whatever I'm wearing, just to put it on something cold. That seems to help, but very, very painful.
This patient's had some previous surgery which left the joints in her feet stiff, and we're trying to make her some insoles, especially for her, that control and stabilise the foot problem. And hopefully the foot will function better and she'll be able to walk more comfortably.
Most of our patients refer themselves. As well as that, you can be referred via your GP or other healthcare professionals, or via the Choose and Book service.
I'm a keen golfer, but I have been having a bit of trouble with my left toe, the big one, which has been giving me a lot of pain. And I was recommended to go to the Queen Victoria Hospital. And from the moment I got there, everybody's been so helpful. The young lady that I saw today has explained everything to me and suggested that the big nail comes off on the left foot. And once that's done, with a bit of luck, everything should be fine.
The podiatric surgery team is based in the new purpose-built day surgery unit at Queen Victoria Memorial Hospital in Herne Bay. A variety of surgical procedures are performed there, including corrective surgery for bunions and toe deformities.
It's very nice. You came in, it's tried to relax you, they're all very good to you. And it's lovely and clean and bright. It's just a nice atmosphere.
So today we're going to do a scarf and aching osteotomy. That's a bunion correction. It's our standard bunion correction. So what we need to do is to make some cuts in this first metatarsal, just realign that, put that in a straighter position, and then hold these pieces of bone together with 2 screws. We're then going to do an aching osteotomy, which is taking a wedge of bone out of this toe bone to bring this into a straighter position, the big toe. And again, that will be held with a wire to realign the whole of the big toe in the first metatarsal. So the lady will be bandaged. She'll be able to walk probably the next day, but she won't be the plaster cast. So recovery is fairly quick. The foot will take about 6 weeks to heal. The bones will take 6 weeks to fuse together. The patient, though, won't be in a plaster cast. They'll be able to weight bear the next day. But the healing of the bones is about 6 weeks. Sutures for the skin are out after 2 weeks, so the initial wounds normally heal about 2 weeks.
Each operation is performed under local anaesthetic, which means that the patients can return to their own home the same day. This state-of-the-art facility also has the capacity to have live video link-ups of the surgery to use for training purposes.
I'm here today because I've got something called a Morton's neuroma, which is kind of like a little protective ball of tissue that grows around a nerve that's been damaged. Because about 3 years ago, I dropped a casserole dish on my toe. You can't see anything, but when I want to wear my lovely high-heeled winter boots, it's absolute agony.
This is a neurectomy for a Morton's neuroma, which is a thickened piece of nerve that runs underneath the metatarsal heads and into the toes, and can cause quite a lot of pain when you're walking, and particularly when you've got shoes on. So this operation removes that piece of nerve and takes away that pain.
In a recent patient satisfaction survey, we got nearly 700 responses, and we were really encouraged by the results. We have gained valuable feedback which we will use to improve services for the future.
It's great coming here. The staff are really professional with me as a parent, but more importantly, they treat Lola appropriately for her age. They engage with her and they make sure that she understands what they're doing for her.
Oh, I think it's absolutely fantastic. My whole experience here has been marvellous. People have been friendly, very, very professional. And of course this new unit here for the surgery is just sparkling. I'm quite sure I couldn't possibly have got any better service if I'd gone privately.
I'm really proud of the whole podiatry department and the way they work so well as a team, and that includes the support we get from our administration and secretarial staff, technicians and podiatry assistants. For further information about the podiatry service, please visit our website www.podiatry.co.uk. eckcommunityservices.nhs.uk, or you may contact the Head of Podiatry on 01 227 594728.